Good day, everyone. Bienvenidos a todos. My name is Charlie Rodriguez. I'm with the Medical Tourism Association, and I'm very proud to be here today supporting Puerto Rico as a world-class destination for health and wellness travel. Puerto Rico is in a very unique position in the industry, providing the quality and outcomes of a U.S. health system at a fraction of the cost. Puerto Rico is also raising the bar when it comes to the medical tourism experience, implementing the highest standards and processes throughout the entire healthcare, hospitality, and support systems. We're very fortunate to have with us today two of the leading experts here to share with us the fantastic work that's being done in Puerto Rico. We have Mr. Francisco Bonet, the Executive Director of the Puerto Rico Medical Tourism Corporation, and Mr. Julio Julia, President of Más Salud. And now I'd like to introduce Mr. Francisco Bonet of the Puerto Rico Medical Tourism Corporation. Good morning, Francisco.
Good morning, Charlie. Buenos dias, and good morning to all the audience today in this webcast about the Puerto Rico Medical Tourism Initiative that we are working right now in an alliance with the Medical Tourism Association. First, we'd like to explain a little bit more about the Puerto Rico Medical Tourism Initiative. We signed a collaboration agreement with the Medical Tourism Association in a partnership between both entities, the Puerto Rico Medical Tourism Board and the Medical Tourism Association. In 2014, we launched our campaign, our brand efforts in the World Medical Tourism Congress. Also, we signed the agreement to train and certify the local providers in the island. So at the end of the day, that's very important because Puerto Rico is a medical tourism destination with all the medical providers, hospitals, dental clinics, ambulatory clinics, and also supporting industries that already take their courses to comply with the international requirements to receive this kind of international patients. Right now we have around 100 supporting industry professionals in the medical tourism cluster in the island, about 20 hotels certified under our network, and our projections in this initiative for the Economic Development Department, that is the government agency in charge of the economic development efforts in Puerto Rico. The medical tourism is one of the most important strategies for this administration to promote economic impact through the international patients that we already receive and the others that we are supposed to receive under these efforts that we are working right now. Our projections at the end of 2017 are about 300 million in revenue to the island in economic impact, around 3,000 jobs, and our projection is to receive around 30,000 patients at the end of 2017. It's important that you know that Puerto Rico already received around 12,000 patients a year, mainly from the Caribbean islands, but we are very aggressive in our promotional marketing efforts in the U.S. because at the end of the day, Puerto Rico is part of the U.S. and we need to comply with all the standard and regulations that apply to the continental U.S. Actually, Puerto Rico and our branding efforts we are the 5-star healthcare on the All-Star Island. Our branding efforts in the U.S. in the tourism side are that Puerto Rico have all the competitive advantage to become one of the main tourism destinations worldwide. We have a lot of important venues in Puerto Rico, a lot of beaches, a lot of important architectural sites. So Puerto Rico is an important touristic destination in the Caribbean, and right now we are focused to promote and to increase this niche market of medical tourism as a part of the strategic plan that the government of Puerto Rico have, and the government agency in charge to promote this and to develop this initiative, the Puerto Rico Medical Tourism Corps, that is a government entity under the Puerto Rico Tourism Company in the island. We have a unique proposition to become one of the key players and the top players in the medical tourism industry, not only in the region, but worldwide. First of all of our doctors are U.S. board certified. That's very important. Also, our hospitals are accredited by the Joint Commission. In Puerto Rico, we have 60 hospitals. 50 of that 60 hospitals are Joint Commission accredited. So at the end of the day, Puerto Rico is the jurisdiction outside the U.S. with most of the hospitals under the Joint Commission. And this is very important because at the end of the day, when a patient decides to travel outside their country, it's important that you look the quality, not only the doctors, but also the hospitals and the clinics. And in Puerto Rico, it's very important because we are regulated by the United States. And in Puerto Rico, we have federal and state legal systems. So at the end of the day, you are protected by the federal regulations. And in Puerto Rico, we need to comply with all the standards that apply to hospitals and physicians in the continental U.S. We have the most advanced technology in the Caribbean. Puerto Rico offers top-notch health and wellness infrastructure. For example, in Puerto Rico, we have the most advanced medical equipment. For example, the Da Vinci machines, the Gamma Knife machines. In Puerto Rico, we do the first transplants in the Caribbean. So Puerto Rico right now have the most advanced infrastructure, not only the Caribbean, but also in Central America. One of the most important competitive advantage that Puerto Rico have is the price. In Puerto Rico, the cost for surgical and dental services are about 40 to 60% lower compared to the continental U.S. In the case of dental procedures, it will be 70% lower compared to the continental U.S. So this is very important because that is one of the most important competitive advantage that we have. So the patient in the U.S. doesn't need to sacrifice quality because we are under the same U.S. standards, but we have lower cost. This is very important not only for the patient, but one of our target markets is the self-insured companies in the U.S. So at the end of the day, the self-insured companies, it's important to look Puerto Rico as the better options to send their employees and receive the medical treatments in Puerto Rico because we are under the same U.S. standards, but we have lower cost. Accessibility. Puerto Rico is a friendly healthcare, friendly healthcare professionals, all bilingual, fluent in English and Spanish. This second competitive advantage is very important because in terms of the air access, we have many direct flights from to the main cities, from or to the main cities in the continental United States. In Puerto Rico, we have around 400 direct flights to the most important cities in the U.S. in a weekly basis, and we are increasing that. The Puerto Rico Tourism Company have an aggressive campaign to increase our air access, not only from the U.S., but for important cities in Latin America, for example, Colombia, Peru, Panama, Mexico. So the Puerto Rico Tourism Company are very aggressive and are doing a great job to increase our air access to many places worldwide. So this is very important. For the U.S. citizens that look Puerto Rico as an option, one of the competitive advantage is that you don't need passport or visa to travel to Puerto Rico for U.S. citizens. So that is very important because there's a lot of people, U.S. citizens in the United States that don't have a passport. So Puerto Rico is a better option if you decide to travel outside the U.S. to receive medical treatment or any medical procedure. Our strategic plan is focused on three main phases under this medical tourism initiative in Puerto Rico. The first one is the training and certification program. As I explained, we signed a collaboration agreement with the Medical Tourism Association in the U.S. to train and certify the local providers in Puerto Rico. We need to have the best physicians, the best hospitals, the best clinics under our network, because at the end of the day, we promote the best quality that Puerto Rico offers to international patients and to patients in the U.S. So we start our training and certification process last year in a monthly basis, and we train and certify hospital clinics, ambulatory clinics, dental clinics, hospitals, all companies and persons that at the end of the day are in charge to receive that patients and to do the best effort to comply and to treat these patients with the best quality possible. The second phase of our medical tourism initiative is the concierge center for the medical tourists. We signed a contract with a local company in Puerto Rico, a private company in Puerto Rico, to run the concierge center in the island. This company will be in charge of all the operational logistics to receive the patients in Puerto Rico and canalize all the services that the patient needs with the local providers that we have under our medical tourism network. We will announce our medical tourism concierge in June in our event, the Caribe Health Summit, that will take place the June 9 this year. And in this event, we will announce our medical tourism concierge with all the efforts that they will be doing. For example, the medical tourism concierge will have an electronic platform that will have the opportunity to identify the patients, the origin of the patients, the needs that they have, and all the process through all the needs that that patients receive in Puerto Rico. So that's very important because the government of Puerto Rico identified this opportunity, and we are a medical tourism destination that do this innovation for the medical tourism patient. So we will announce the Medical Concierge Center in June. Our third phase of the medical tourism initiative is our marketing and promotional plan. We are very aggressive in different target markets to promote Puerto Rico as the better option for international patients, but mainly for that U.S. citizens that are looking for options outside the U.S. For example, we are promoting the medical tourism destination Puerto Rico in their Airlines, American Airlines, International Living Magazine, through the Medical Tourism Association, social media, and different efforts. And we are very aggressive in the U.S. Other example, we are launch a campaign in Lifetime and Network in all the U.S. For 6 months. And we are investing a lot of money to promote Puerto Rico as the better option for that patient that are looking services outside the U.S. The training and certification program is very important because we are the first country that signed this kind of agreement with the Medical Tourism Association to train and certify the local providers in Puerto Rico. The Medical Tourism Corp established a program with the Medical Tourism Association to train and certify all the participant providers in Puerto Rico. If the provider doesn't comply with the training process, they don't have their certification. And that's very important because we like to promote the best quality providers that Puerto Rico have. And for us, this is one of the main pillars of our medical tourism initiative. Right now, we have around 54, 52 certified providers. For example, we have 13 hospitals, 15 ambulatory clinics, 5 dental clinics, 8 hospitals, and about 20 supporting industries on ancillary services. So right now we have a medical tourism cluster very diverse and with different kind of services to the benefit of that patients that are looking Puerto Rico as the better option. The concierge center in Puerto Rico will be easy, simple, and convenient. And in the Caribe Health Summit in June 9, we will announce all the efforts and all the services that the concierge center we will have for the benefit of that patients in Puerto Rico, and also for the benefit for the local providers. At the end of the day, the local providers, it's important to see the concierge center as an outsourcing service for their benefit to receive that patients and to move that patients to all the process they need to receive their best medical treatment in the island. How it works is important. For us in Puerto Rico, our target market are direct patients, self-insured companies, health insurance companies, facilitators, buyers, and others. That's our target market. And we will start sales efforts in the U.S. Through the concierge center. They will have a sales representative in the U.S. to identify that potential patients or potential clients in the U.S. to sign contracts for the referral of the patients. So the concierge hub or the concierge center, they will be in charge of all the patient experience in terms of hotels, hospital, medical appointments, not only for the patient, but also for the companions. That's very important. And they will be in charge to do the medical appointments and all the needs that the patients and the companions need when they stay in Puerto Rico to receive their medical treatments. Our promotion and our marketing efforts are very important because it's very integrated marketing efforts in different target markets. It's important that our potential patient know our destination, like the services that they receive in Puerto Rico, and trust in the medical tourism destination of Puerto Rico. We have all the competitive advantage to become one of the key players in this industry worldwide. And we are doing our best to let them know that potential patient in the U.S. and other markets that Puerto Rico is the better option. Right here you see a couple of examples that we do in the past. For example, in American Airlines Magazine, Delta Airlines Magazine, and they focus, these ad campaigns are focused in the different medical procedures that we are promoting in different markets. For example, in Puerto Rico, we identify 8 medical procedures that we know that we have the most competitive advantage in the region. For example, if you see in this ad that we are promoting in different marketing channels, dental procedures, spine surgeon, cosmetic surgery, this type of campaign change in 3-4 months with different call to action. But these one are examples that we are doing in different magazines, in different marketing channels. We are in Pandora Radio in the US, in the tri-state area in Florida. So this is very important for us. For us, our webpage is the first marketing tool and the first source of information for that potential patient. This is a look and feel of our webpage. The webpage is www.starhealthcarepuertorico.com. www.starhealthcarepuertorico.com. In this webpage, the potential patient have the opportunity to see all the medical providers and all the providers that we have under our medical tourism network. Also, they will have the opportunity to see and to know very important information regarding our tourism destination, and also see testimonials of patients that receive their medical treatment or their medical procedures in the island. So this is very important for that patient that are considered Puerto Rico as a medical tourism destination to receive their medical treatment. This webpage change in a monthly basis in the way that we certify new providers. But you have the opportunity to see the different providers in our webpage with the information, the medical procedures that they do, all the information of the physicians, their education background, their medical procedures that they do right now in Puerto Rico, all the fellowships that they have in the U.S. or other places worldwide. So it's a huge and a robust platform, web page with all the information that the patient needs to decide to come to Puerto Rico to receive the medical treatment or the medical procedures. In the next months, the web page will have the opportunity to the patient will have the opportunity not only to learn about the medical tourism destination, but also to plan their medical appointments and their medical procedures that they need in the island, and also to book directly with one of our medical tourism providers their medical appointments at their need that they have in Puerto Rico under the concierge center that we will have. The patient will have the opportunity to plan and book their medical appointments and anything, but with the hope of the case managers that we will have until June in the concierge center for the medical tourism initiative in the island. Right now, we will talk about the Caribe Health Summit, our premier event of medical tourism in Puerto Rico. It's the most important medical tourism event in the Caribbean region. And Charlie, go ahead.
Thank you, Francisco, for that informative presentation. Right now, we'd like to introduce the president of Más Salud, Mr. Julio Julia, who is going to tell us about the upcoming Caribe Health Summit. Good morning, Julio.
Thank you, Charlie, and buenos días a todos, and good morning, everyone. I'm happy to be talking about the Caribe Health Summit on its second edition. I'm glad to tell everybody that in just 2 editions, we are already the largest healthcare conference in the Caribbean dealing with international healthcare issues and particularly medical tourism. Last year, we had over 300 attendees, including over 30 healthcare buyers. And you know, for those who don't know, healthcare buyer could be either health insurance executive, an agent, brokers, and anyone outside of Puerto Rico and perhaps outside of the United States looking to buy healthcare services abroad. And certainly in Puerto Rico, we want to position ourselves as a preferred destination for those services. The Caribe Health Summit, if we go to the next slide, it's going to be held on June 9 at the Ritz-Carlton Hotel. And you know, needless to say, I don't have to say much about Ritz-Carlton. We're talking a 5-star hotel, one of the best hotels or better hotels in Puerto Rico, particularly in the San Juan area, very well located, just next to the airport, less than 5 minutes from the airport, I should say, and it's an oceanfront facility, very nice. I think that people will be very impressed with the setting. So again, the Caribe Health Summit will be on June 9th at the Ritz-Carlton Hotel in San Juan, Puerto Rico. And we wanted to have the opportunity to share with you some of our speakers that are confirmed. We're still in the process of confirming others. But just to give you a flavor of the kind of speakers that we're going to be presenting, we're going to have Dr. Douglas Wan. Dr. Douglas Wan is a very well-known, internationally well-known, minimally invasive surgeon, spine surgeon out of Dallas, but also with offices in Puerto Rico. And particularly, that's one of the aspects that we're going to promote this year as opposed to last year in terms of the Caribe Health Summit. We want to promote alliances. We want to promote global alliances with healthcare providers abroad, not necessarily in the United States, but also in South America and other countries that can benefit from an exchange with Puerto Rico. We also going to have Rosana Gomez Moreno, who's an attorney, and she's going to be talking particularly with all the legalities and the legal aspects of these international affiliations and alliance. John Adelheid, which most of you know, is the CEO of the Medical Tourism Association, and he's going to be talking about what's going on in medical tourism internationally. We also are having Anuja Agrawal, who is the CEO of Health Flight Solutions, and as Francisco was mentioning earlier, Anuja is the CEO of Health Flight, and she is going to be talking about particularly the software and the platform that the Concierge Center is going to be using to manage the patient experience. If there's something that we want to do in Puerto Rico different from other destinations, is we want to provide those medical tourists with a different experience. And we truly believe that Anuja and Health Flights will provide that to the healthcare, to the patients and medical tourists visiting us. We also are going to have Dr. Stephen Ullman for another year. Dr. Ullman is well known internationally. He's a professor at the University of Miami, very well known in global healthcare issues. And so he's going to be talking also what's going on in the international landscape of healthcare when it comes to exchanges of healthcare services. And Brad Cook is very well known in the medical tourism world. He's been he was one of the pioneers in providing services to medical tourists out of Costa Rica. He's been doing it for almost 20 years. So a very well known and respected expert in the medical tourism world. Going on to the next slide and into a little bit of the agenda. On June 9th, we're going to have a full day of activities, and these are some of the topics. I'm not necessarily going to go over all of them. I want to point out that the concierge services will take a big part of the day, explaining what does that mean? Why are we investing so much in developing a world-class concierge type services just for the medical tourists? And as most of you know, that will make us unique. Some destinations have done it as some sort of concierge services, but at the provider level. What make us different in Puerto Rico is that we're doing it as a destination. We're doing it as a country. The entire country is putting all the resources together and to create a unique experience, more, if you will, more standardized for the medical tourist. Puerto Rico is a powerhouse today. Is a powerhouse of the Caribe. Is a powerhouse of healthcare powerhouse of the Caribbean. It has been for many years. We offer more specialized healthcare services than any country within the Caribbean region. Today we received over 13,000 patients from the Caribbean islands. We're the preferred destination for those patients. What we want to promote through this conference is particularly improve our penetration within the Caribbean region, but also target some specific regions within the United States, mostly the East Coast, and those areas with a high concentration of Hispanic population, as well as South America. We're going to talk throughout the day also about other emerging markets, such as medical cannabis, which is obviously a hot topic internationally, and Puerto Rico would like to become a pioneer in the discussion of medical cannabis as also as an economic development activity. We also, as we did last year, we're going to give you an update on what's going on with all the incentive programs that the Department of Commerce in Puerto Rico have put together to incentivize companies from the United States and abroad to invest into healthcare in Puerto Rico, and we're going to be talking about that. We are expecting this year well over 30 buyers again coming again from insurance companies, brokers, facilitators of healthcare services, agents, and so on. On the following day, if you go to the next slide, on June 10th, we're going to have our fan trip, familiarization trip. And this is an event that we did pretty successfully last year. We took, again, our 30 of our buyers around the different hospitals, ancillary services, dental clinics, ambulatory clinics, mostly around the metropolitan area. We have a lot more to show, like Francisco was mentioning. We have our over 50 hospitals that are Joint Commission accredited across the island. However, for the sake of time, we're going to be limiting ourselves mostly to the greater metropolitan area hospitals, and I think it will give you a good flavor of what we have to offer as a destination in terms of healthcare services. So if all of you who would like to get more information about the Caribe Health Summit, we do have a website available. It's www.caribehealthsummit.com. And the registration, you can register yourself at www.caribehealthsummit2016.eventbrite.com. So with what that said, I'm going to turn it over to any questions.
Thank you, Julio. We look forward to seeing you and Francisco and all of the great healthcare providers and participants at the summit in June. We're certainly looking forward to that, and we want to communicate to everyone that the Medical Tourism Association is supporting this event, and we are working very closely with the organizers to bring some of these healthcare buyers that Julio was mentioning. Now we do have a few questions from the audience. Wanda wanted to know who will participate in the summit. So what is the profile of attendee of the Carib Summit?
Yes, the profile of the participants in the summit is local providers, international providers, but it's important that it's an event for the international buyers to see the local providers that Puerto Rico have, and also the infrastructure that Puerto Rico offers. So for us, it's very important for the international buyers that we already have confirmed. We have about 40 international buyers, mainly from the US, Canada, and also Latin America, to come to Puerto Rico to have the opportunity to see the speakers that we will have in the summit, but also in the fan trip to see the infrastructure that Puerto Rico have, and at the end of the day, close deals with the local providers in Puerto Rico for the referral of patients.
Also, if I may add, I will say that anybody interested in healthcare in Puerto Rico has a place in this summit. I think you'll find it very informative. You're going to find it interesting. So So in general, certainly the summit is designed to promote medical tourism particularly and alliances, healthcare alliances with between healthcare providers in Puerto Rico and others abroad. But for the most part, anybody who is interested in healthcare, what's going on out there, what are the new trends in healthcare, I think will enjoy participating in this conference.
Very good. Ben wanted to know if there is an additional registration required to participate in the FAM trip, and can anyone participate in the FAM trip?
Now, if you are a buyer, and like to have the opportunity to go to the FAM trip, you will need to go to our website, CaribeHealthSummit.com. We see the website right here. So if the buyer like to participate in the FAM trip, it's important to sign and to require to be part of the FAM trip. But the FAM trip is for buyers, facilitators, and all companies that are looking Puerto Rico for the referral of patients to the island.
Thank you. Chris also was asking, how will health insurance companies benefit from coming to the Caribe Health Summit?
Well, certainly, if I may, Francisco, health insurance companies is a big component of the potential of medical tourism worldwide. I have always said throughout the years in Puerto Rico, for all the done now, Puerto Rico, we have the largest U.S. health insurance companies actually present for many years, such as names such as Humana, Cigna, Blue Cross, are companies that have been in Puerto Rico for many years. And we would like to promote alliances between their health insurance sister companies in the U.S. and the local companies in Puerto Rico, and see how can we exchange patients in a more efficient and cost-effective manner.
Very good. Very good. We have a question about the concierge center. John wanted to know what the benefits are of the concierge center and if there are any costs.
There will be a cost for the provider, an initial fee to become part of the concierge service program, because we are investing in an electronic platform to have all the providers under the same network, under the same electronic technology network, the concierge center and also the Puerto Rico Medical Tourism Corp. It's important that all the providers have the opportunity to know that at the end of the day, we would like to have the economic impact and to have the opportunity to see the numbers in terms of economic impact, all the services that the patient needs, what are the procedures that they need. So there will be an initial fee to have the opportunity to any provider have the electronic platform in his clinic, hospital, etc. But it's important that the provider see this as an outsourcing service for their facilities. The concierge center will be in charge to the referral of the patients for the local providers under the medical tourism network, and it's an outsourcing service for their benefit.
There's no cost to the patient, Francisco?
Oh, Charlie.
Yes.
If I may add to what Francisco was mentioning about the concierge services, the concierge center will be doing all the hand-holding that is so important in medical tourism. Typically, these patients come from abroad. Some of them for the first time they're traveling and so on, and we felt that it was absolutely important to control that experience in a way that they don't feel lost at any point throughout their medical tourism experience. So It is a center that will be in charge of coordinating everything that has to do with the provider, to the patients, to their companions, flights, transportation. Everything will be coordinated through a hub, a centralized area, and this is the concierge, and we're going to be talking a lot more during the summit.
Great, great. And we have a question from Oscar, wanted to know if the Puerto Rican hospitals will be working with medical tourism facilitators, and what will be the treatments that will be available.
Yeah, the Puerto Rico hospitals are working right now with different facilitators in the Caribbean and also the U.S. The facilitators are integrated part of this initiative. So the hospitals right now are working directly also with facilitators. Right now we receive around 12 or 13,000 patients a year, mainly from the Caribbean islands, but also from the U.S. And the hospitals close deals directly with facilitators for that referral of patients. The medical procedures that we are promoting are cardiology, pediatric, bariatric surgery, cosmetic surgery, dental procedures, ophthalmology, orthopedics. So that are the medical procedures that we are promoting in the different target market that we have. That is the Caribbean, the U.S., mainly the East Coast of the U.S. As Julio mentioned, in the East Coast of the U.S. lives the most of the Hispanic population and also the Puerto Ricans that are moving to the U.S. So for us, it's very important the East Coast of the U.S. and also different markets in Latin America. The government of Puerto Rico have commercial offices in that country. For example, Dominican Republic, Panama, Peru, and Colombia.
Very good. And we have a final question from Shiva, who wanted to know how participants can get a copy of today's recording, if that is possible.
Yeah, that is possible for the benefit of the audience. We can share this presentation, and if the audience have other questions and need to have our presentations and our marketing strategy, we can share with the audience for the benefit of them.
Okay, and how will they be able to get the copy?
We can send an email directly to me. It's francisco.bonet at D as Daniel, D as David, ec.pr.gov.
Very, very well. And you can also contact the Medical Tourism Association, Charlie at medicaltourismassociation.com. We'll be happy to assist as well. We want to thank our expert panelists, Francisco and Julio, for participating in this morning's webcast. We want to thank all of the participants around the world. We look forward to answering any questions that you may have, and of course to seeing you on June 9th in San Juan, Puerto Rico at the Caribe Health Summit. Have a great day, everyone. Cheers.